Alzheimer's disease is one of the most common and deadly neurological conditions among the elderly population. This disease is characterized by memory loss, language and speech problems, personality changes, and other cognitive function impairments. Alzheimer's disease can significantly affect quality of life and can lead to life-threatening situations as the disease progresses. This podcast video will delve more deeply into Alzheimer's disease and provide information on its causes, symptoms, diagnosis, treatment, and prevention. The brain regions affected by the disease and how they are affected will also be explained. We will also discuss the risk factors for Alzheimer's disease and preventive measures. Additionally, this podcast video aims to address misconceptions and myths about Alzheimer's disease. Having accurate knowledge about what the disease is and is not can help those who have the disease and their caregivers. By watching this podcast video, you will be able to gain a more detailed understanding of the causes, symptoms, diagnosis, and treatment of Alzheimer's disease, as well as learn ways to prevent the disease. Alzheimer's disease causes a gradual loss of mental functions due to the death of brain cells and damage to brain tissue. The symptoms of the disease may be mild in the early stages but can worsen as the disease progresses. The most common symptoms of Alzheimer's disease include memory loss, difficulty in remembering recent events, or forgetting previously remembered information. Loss of time and spatial awareness, difficulty in recalling one's location, neighborhood, or city. Language and speech problems, forgetting words, mixing up names, or struggling to complete sentences. Problem-solving difficulties, struggling to perform simple calculations and planning tasks. Decision-making challenges, difficulty in evaluating different options. Visual perception problems, difficulty in distinguishing colors, recognizing faces and seeing distant objects. Personality changes, development of behaviors or habits that were not previously present. These symptoms can worsen in the later stages of Alzheimer's disease and significantly affect a person's daily life. Therefore, early diagnosis and treatment are important to slow the progression of the disease or alleviate its symptoms. Alzheimer's disease is a disease whose exact cause is not known. However, research shows that genetic factors, aging, brain injuries, stress, infections, and environmental factors can increase the risk of the disease. Genetic factors have been found to increase the susceptibility to Alzheimer's disease in some families. Additionally, aging is the most important factor that increases the risk of Alzheimer's disease. Approximately 3 out of every 10 people over the age of 65 have Alzheimer's disease. Brain injuries can also increase the risk of Alzheimer's disease. Specifically, repeated brain injuries are more common in at-risk groups such as athletes or military personnel. Stress does not cause Alzheimer's disease, but coping methods used to deal with stress can increase the risk of the disease. For example, poor dietary habits, sleep deprivation, and excessive alcohol consumption can increase the risk of Alzheimer's disease. In conclusion, while the exact cause of Alzheimer's disease is not known, research shows that certain factors can increase the risk of the disease. Therefore, controlling and preventing factors such as aging, genetic factors, brain injuries, and stress management techniques can reduce the risk of developing Alzheimer's disease. The definitive diagnosis of Alzheimer's disease can only be made through autopsy. However, early diagnosis of the disease allows for more effective treatment options. Therefore, various tests and evaluations can be performed to diagnose Alzheimer's disease. Cognitive tests that evaluate the patient's brain functions and behaviors are important tools used in the diagnosis of Alzheimer's disease. In addition, brain imaging methods such as MRI, PET, and SPECT can also be used for the diagnosis of the disease. The treatment of Alzheimer's disease is still an area where complete success is not yet possible. However, early diagnosis and appropriate treatment methods can slow down the progression of the disease and alleviate its symptoms. Treatment options may include medication, cognitive and behavioral therapies, physical activity, and nutrition programs. Some medications can alleviate symptoms by regulating communication between neurons in the brain. Cognitive and behavioral therapies can improve the patient's functionality and help maintain independence in daily life. Physical activity and a healthy nutrition program can also help slow down the progression of the disease. In conclusion, Alzheimer's disease can be managed with appropriate treatment methods when diagnosed early. Therefore, it is important to consult a healthcare professional when any symptoms are noticed. Unfortunately, there is currently no definitive prevention method for Alzheimer's disease. However, some research suggests that lifestyle changes can help reduce the risk of developing Alzheimer's. In particular, regular physical activity, a healthy diet, and social connections can help reduce the risk of Alzheimer's disease. Regular exercise can improve brain function and increase blood flow to nourish brain cells. A healthy diet can also help support brain health by providing antioxidants and other nutrients. Social connections can also contribute to brain health. In addition, stress management can also help reduce the risk of Alzheimer's disease. During stressful situations, cortisol hormone is released and can damage brain cells in the long run. Therefore, regular meditation, yoga, and other stress reduction techniques can be effective in reducing the risk of Alzheimer's disease. In conclusion, although there is no definitive prevention method for Alzheimer's disease, healthy lifestyle changes can help reduce the risk of the disease. Factors such as regular physical activity, a healthy diet, social connections, and stress management can help maintain brain health and reduce the risk of Alzheimer's disease. Alzheimer's disease is a neurodegenerative disease that increases with age and still has no definitive cure. However, early detection and management of the disease is possible. Therefore, it is important to seek medical attention when symptoms appear. Symptoms of Alzheimer's disease include memory loss, mental confusion, personality and behavior changes, and difficulties in performing daily activities. These symptoms can be detected through various tests used to diagnose the disease. For accurate diagnosis, a comprehensive evaluation by a specialist such as a neurologist or psychiatrist is necessary. Treatment options include medication, therapies, and lifestyle changes. However, there is still no definitive treatment method. However, early detection and management of the disease in its early stages can slow the worsening of symptoms and improve quality of life. In conclusion, Alzheimer's disease is a serious health problem that affects not only individuals but also their families. Therefore, it is important to be knowledgeable about the disease, recognize the symptoms, be familiar with diagnosis and treatment options, and take preventive measures. If you or your loved ones notice these symptoms, it is recommended that you seek medical attention without delay. If you enjoyed this podcast, don't forget to subscribe to our channel for more informative content like this. Stay up to date with the latest episodes and never miss out on the valuable insights shared by our experts. Thank you for listening.